It was a Friday in September, 2 years ago. I had to make a call. My wife Kim was at work at her job at a public school. It's a phone call I'll never forget. Kim, I just got off the call with your doctor. It's about the blood work you had done yesterday. The results are really abnormal. Something really doesn't seem quite right here. I'm going to come pick you up at work right now, and we're going to go and get your blood test redone, and we'll sort these things out. Now, her response tells you a lot about her. She said, Paul, I can't leave work right now. I have bus duty this afternoon. And so began our journey. Within a few hours, she was in the ICU. She was really sick. Within a few days, the diagnosis was confirmed, multiple myeloma. Kim had several months of outpatient therapy, and then in February 2017, an autologous stem cell transplant at the Methodist Hospital in San Antonio, Texas. Today, she's in remission, and she's doing great. Kim has been cared for by excellent physicians. She's been at 2 exceptionally good hospitals. She's been part of a fantastic transplant program. She's married to a medical oncologist who can interpret, who can remember, who can coach, who can hopefully help make good decisions, and I hope can provide pretty good medical care at home. Our kids have been able to come home at critical times in the process. We've had family and friends who could stay with her, who could bring us food, who could give her rides to the doctor when she was too weak to drive. If you think of all the resources that a cancer patient needs, Kim has everything. And even though she has every possible resource, this experience has been brutal. But I often stop to think about, what is it like for those who have no resources? It's absolutely true what is said, that the main problem with the healthcare system in the United States is that there is no system. There are so many places where people can fall through the cracks, so many places where people can fail to get the resources they need to achieve the best possible outcome. We need to be committed to closing those gaps. We need to always think about how we can smooth the way for all cancer patients. Just 2 thoughts. First of all, navigators make a huge difference for cancer patients. They help patients understand. They get patients to the next place in their process. They provide that incredible support that patients need. And yet, no payer pays for navigators. Second of all, we exacerbate the anxiety of our patients when we suggest that they have to go to a big-name cancer center somewhere to receive appropriate treatment for their cancer. The truth is that most patients with most diagnoses can stay in their local community and receive care that is in compliance, that's right along with the very best medical research. We all know what we're here for. We all know what we're fighting against. We're fighting against cancer. But let's never forget who we're fighting for.